Everybody, welcome back. We have with us Dr. Chloe Carmichael yet again, friend of the show, Dr. Chloe Carmichael. She's been on before when she had a book out called, well, actually, it had already been well produced, and I had just discovered it called Nervous Energy. She's got a new book now that we're going to get to. But more importantly, she had an article published in the Open Therapy Institute Frontiers in Mental Health Journal called Self-Censorship is Becoming a Mental Health Crisis. And it was so good that I was like, hey, well, you need to come back on the show and we need to talk about this because it's a big deal. So, welcome, Dr. Chloe. How are you?
Thank you, Jake. It is so good to be with you, and I'm really glad that the article reached you and spoke to you. I definitely think people are waking up to the fact that there is a mental health cost to self-censorship.
There is, and we're going to get into some of that. But before we do, I wanted you to know that I forwarded your article far and wide, and
Oh, thank
one of our brethren, Patrick Lockwood, who is a psychologist down in Southern California in the Malibu area, wrote back, and I'm just going to read it real quick. He says, I think there are various reasons why patients lie to collective, in parentheses, us. One, and there is an article you hyperlink too, so I want to get that out of the way. There's a research study, it cites things, but I want to share Patrick's observations because I think they're quite good. Transference, countertransference, and then parenthetically on this, he says we treat them special for some pathological reason of our own, which reinforces a quote idealized state of therapy. The patient feels compelled to continue, which I thought was really interesting. Cultural norms, gender differences, age differences. People have all sorts of beliefs about respect, honesty, etc., people pleasing. And the research article did touch on that, how sometimes they want to impress us as therapists, so they'll lie. Personality differences. People who are more temperamentally agreeable tend to engage in white lies, often for the sake of social cohesion. He says shitty parenting, lack of role models for honesty and accountability. And then the last one, psychopathology, and he deals specifically with a lot of addiction stuff. He says addiction is a disease of deception. Personality disorders achieve homeostasis via useful fictions, etc. And I thought that was really poignant because I do want to touch on specifically cluster B personality disorders, but they do achieve homeostasis through fictions. And I thought addiction is a disease of deception was a really interesting framework for this too about, why do people self-censor? Why do they outright lie when asked, especially to people like you and me who are supposed to be this quote unquote safe space for them to explore their deepest, darkest. So let's get into it. Let's talk about what you've written and your opinions and hypotheses and why this is so troubling.
Yeah, that's interesting, Jake. I mean, one thing that I think of from what you just said there about, you know, cluster B and fictions, is that fictions, I think, also set the stage for cluster B. So, people that have personality disorders not only, might present with fiction, but it's also sometimes when people are in, say, very, very heavy denial, that's when they could start to, display cluster B. And what I see that looking like sometimes in just day-to-day life in general culture, not even necessarily, within therapy, is that there's this desire to stamp out hate speech and bullying, right?
Right,
To
right, right.
silence anybody or anything that could, by any stretch of the imagination, be labeled as misogyny or racist or transphobic or whatever. And so then we go into what's called suppression, which is, I imagine probably most of is your audience mostly therapists?
It's really quite a mixed bag, as it turns out. We have some lay people, some therapists, I mean, it really runs the gamut. But maybe we should define terms because I think that's where you're
Yes,
going.
I
But
was
first,
thinking that.
yeah,
So I'll just,
cluster B. I was going to
yeah.
say cluster B. First of all, there's a set of personality disorders, and I go into this in other areas. But cluster B is your narcissistic, histrionic, antisocial, and borderline. But please talk about suppression because that's a defense mechanism we don't talk about enough.
Yeah, so and I'm glad you broke down the cluster B stuff too. But so when we choose to silence ourselves actively, then we're doing what's called suppression. When it becomes kind of automatic and somewhat second nature, then it's repression. And then repression can ultimately graduate to denial, which is,
Right.
as you know, like where we're just not even aware at all of how we feel. And if somebody said, I think you're angry about such and such, we might say, no, I'm really not. And in our
I'm not
mind, like we
angry.
we 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 mean it, right? And the truth is it's there in the background, but we've just simply dissociated from it. And I think that happens when people feel extreme pressure to self-censor whatever might be, some kind of a politically incorrect idea. And what's interesting as well is that when we censor ourselves in, suppression, repression, denial, that's when we're more vulnerable to passive aggression, acting out, violence, all of those types of things. And so I connect the fact that groups of people who are statistically more likely to defriend over political differences, drop contact, disinvite a speaker, people who display what I call dialogue intolerance are also statistically more likely to endorse political violence. And
Mm.
I don't think that those two things are disconnected. Because as we know, if you're dealing with violent offenders or people with anger management problems, one of the first things you want to do is get them to engage in dialogue, to use their words, to boost up their emotional vocabulary. And so I think that it's kind of an opposite dynamic where even for what were imaginably noble intentions that people thought, oh, well, we'll stamp out hate speech and bullying, and we just won't dialogue with anybody who says anything politically incorrect. Ironically, those very same people are setting themselves up for that cluster B, histrionic, borderline, violent, sporadic acting out that we are seeing so much of now. And by the way, I think it's a lot within our own profession. So it's an interesting question of like how it, kind of intersects with therapy, because I think a lot of therapists, frankly, are part of the problem.
Yeah, for sure. I mean, what you're describing there is just broad-based invalidation, right? If somebody comes with an opinion you don't like and you say you're not allowed to have it or express it in my presence, it's invalidating. So trace that all the way back to childhood invalidation when a child comes to a parent and complains about something and the parent says, get out of my face, you're not allowed to bring that opinion to me. Same process, right? Only now we're doing it at a professional level. And to your point about our own profession, this is actively being taught in grad schools. I've hosted grad students for 10 years now, and it's gotten worse. There are certain opinions that are allowed, certain opinions that are not allowed, and then by extension, those have to come into the professional setting because they're being taught that in the school. So when the pressure that you describe is present in the therapy office, of course, the treated, right, the patients, the clients, will fail to express themselves appropriately. And from my lens, this looks like emotional intolerance because the individual can't possibly go into a place where they're emotionally vulnerable because they're going to get whacked. They're going to get invalidated. Who wants more pain, right? So it's easier just to suppress or to lie or deceive or whatnot. So yeah, it is a big problem. And then if we don't get through that, the problem gets worse. And I think that's where you're going with this is not only to identify it first, we have to openly acknowledge this is a problem, and then we got to solve it. So I leave that in your hands.
Yeah, and when we dissociate from things, suppress them and go into denial, that's when we're less able to work on something and to solve it, or to resolve it. And, that's also the graduation there again of, suppression, repression, denial. The next thing that can happen when that's done in group settings, like as you said in therapy training programs, is then you have a groupthink situation that can go on when it's not just one person going into some, weird little cluster B denial pattern all by themselves. You can have a whole industry, that goes into that as well. So what
Totally.
that looks like, I think, within our profession, there's a therapist, her name is Pamela, somebody, you probably know her last name. I can't remember it,
Garfield
but she,
Yeager?
yes, yes.
Yeah,
And
know her
she,
well.
I think, shared something on Twitter. I think it was her, where there was like a video of a CEU bearing continuing education course. And it was about how to essentially deprogram Trump voters, right?
Wow.
I mean, and can you
Yeah.
imagine the groupthink that is involved there to pathologize an entire group, like half the country, that is actually not the half that's, even, committing a great deal of political violence compared, comparatively speaking. So I just, there's this groupthink factor. And again, it's also then our own same profession is leading the charge when it comes to chopping off the healthy body parts, right, of young people, which again, we're getting into that cluster B territory of almost like a, frankly, it's beyond cluster B. It's almost more of a psychotic territory to have this incredibly deep denial of reality. Like, oh, if I put on lipstick and, have a breast implant, then I will be a woman, right? Like it's concrete, black and white psychotic type thinking. And it's, shocking that our own profession is leading the charge, but it's not surprising on the other hand, because our own profession has gotten so politically narrow-minded into a very particular political ideology that espouses these ideas, and there's nobody checking them because they're so incredibly homogenous. It's one of the things I researched and explained in my book is some of the statistics, some of the faculty skews. Like, can you guess what this faculty skew is within the psychology faculty departments in the United States?
You mean politically?
Mm-hmm.
I would say it's probably 90 to 10,
20 to
left to right.
1.
20 to
Yeah.
1.
Yeah.
So that's 80 to 20, or what is that? 20
I
to
think
1
it's
is
worse. I think it's,
95, 5 is how
yeah,
that breaks out, I
yeah,
believe. Yeah. Because you
yeah,
multiply by 5. Yes. 5 20s
yeah,
goes into 100. Yeah. So
yeah.
95 to 5. Wow.
And what that means is that say your average psych department maybe has 10 or 12 professors. It means that it's not at all uncommon, and this was my experience, to be in a psychology department where the entire department is actually identifying only one way politically, right? And then since we think about the fact that politically, politics, if we go to the etymology of the word, it just means your views about public life, right? And so then psychologists are on some level supposed to be setting the norms, the social norms and social standards of what's, a reality-based viewpoint or what's a socially acceptable behavior or viewpoint. And then you have this incredible political skew about people who have a certain value system about public life. Of course, it's skewing the psychology profession then in terms of what they think about as social norms. And what's really shocking to me is that they don't care. I've had conversations with liberal faculty about this problem, and they don't see it as a problem, even though the same people will bend over backwards to make sure that they have at least one person of color or at least X number of women or whatever else physical characteristics. But when it comes to viewpoint diversity, they're it's like it's shocking to me that they're like so disinterested.
I got told at a CE function on the side, was it on the side or in the middle? Something happened. It was years ago, like long before this explosion happened, such that the memory sort of faded. But I distinctly remember the event where I didn't use the phrase viewpoint diversity. I said thought diversity because I was directly challenging the Sue and Sue Counseling a Culturally Diverse book that everybody uses in all their curriculum, and I said, how come there's no? I said, so twice this happened. Once was in grad school, circa 2010. I said, how come there's no poverty diversity in here, economic diversity? Because it was all about race, sex, gender, sexual orientation. I said, what about economics? What about poverty? Because I happened to be working with the impoverished at the time. And I got told that that was a privileged position to take as a white male, and I needed to be more attuned to whatever the according to Hoyle, curriculum said. Well, then just a few years after that, when I had a couple of years of practice under my belt, I said, what about thought diversity in a different setting? And I got the same feedback. I was like, you just aren't getting it, right? White man of privilege. You just aren't getting it. And I'm like, well, what am I not getting? And I couldn't have the dialogue. I couldn't have a reasonable discussion. I knew what I was doing. I was purposely provoking a conversation that they didn't want to have. But let's fast forward now to today's society where you've got a, a bastion of people teaching the fledgling clinicians how to conduct themselves in session. There's an activist overtone. It's not even an undertone anymore. It's an overtone that suggests that therapists cannot be neutral. There is no such thing as therapeutic neutrality anymore because the socially just movement, the justice movement, meaning it means you have to take action. We have language now in our well, in the social work competencies and other competencies, but also in certain guidelines, not necessarily the ethical codes yet, but it's emerging. They say you must take action in the following areas, and it's always this social justice motif. So now we have activist therapists openly trying to, for example, like you bring up, change the minds of Trump voters, for example. So where does this come from? Well, I think because I've wrestled with this for a couple of years, it didn't just magically appear, and I don't believe that there's a bunch of just sheep blindly carrying water for some shadowy regime. I think it's a cultural Marxist takeover. And what I mean by that is Marxism in its traditional form was economic wealth redistribution. Well, I think this is cultural redistribution where they're trying to tear down what the people in charge, and the people in charge would be the professors in this case, have deemed and determined to be points of power and privilege. And they get to label them, and we don't get to argue with them. And so those would be like the heteronormative white male, and they call that the dominant culture. Well, the irony is in the psychological field in grad schools, that's not the dominant culture, right? So now you're actually gaslighting the audience into thinking that they're somehow dominant when really they're the minority. Because as a white male in grad school in the psychology profession, I am very much not in the majority. It's like 80 to 85% female at bare minimum on the sex spectrum, not to mention political and all the other things. So there's this inversion happening, and it almost becomes a DARVO. And for the people not familiar with the acronym, it's deny, attack, reverse, victim, and offender, DARVO, DARVO. And it's a narcissistic inversion that occurs. And it occurs only because there's a threat of something behind it that can be actionable. So in a domestic violence situation, the lying and deceit and darvoing and gaslighting comes with the threat of usually physical violence or financial isolation or something like that. Well, in grad school, the threat is we'll just kick you out if you don't comply, if you don't conform with our identitarian politics. So you do shut up and you conform because you want your degree and you want to get out and practice. But the transformation that happens usually to these open-minded 22 to 30-year-olds is so powerful that they can't shake it because once they get out, they encounter not necessarily professors anymore, but supervisors and mentors and bosses and clinical directors who also espouse the same belief set. So over time, the minority opinions get censored, and then it becomes transmuted into the therapy session where the patients then are censoring themselves because they can't trust that the space actually is safe to explore a whole bunch of things, not just political IDs and all that stuff, but also their personal experiences. Is it safe for a male to express in therapy that he's being beaten by his wife? I don't know that that's something that is commonly expressed, but that is one thing that I've encountered. There's a whole litany of stuff that people self-censor on, and as a result, the folks don't heal, right? So, I don't know what we do about that. You have outlined a little bit of a plan for therapists who
Yeah.
are interested.
Yeah, I mean, I just want to say I totally agree with you too about the issue of men. That's another one of those issues where they'll bend over backwards to have all kinds of, just various areas of diversity, but they don't seem to like notice or care that there's, very, very few men. And like they'll roll out free tuition for somebody of color or whatever, even though they have more diversity in that area than they do with, men. And I've never seen efforts to recruit men into therapy programs as students. And as you said,
Well,
they
it's
they
because they've established that men are already advantaged, right? It's like the statistics be damned, and forget the fact that men, specifically 45 to 60, commit suicide at the highest rates of any demographic, especially white men. We'll just throw those out because we've decided that you're bad and you're the enemy and you're the devil, and we're not going to help you, right?
I
So
know.
that's why.
And as you said, all of this feeds into the therapy room in a way that I believe is truly harmful because I've seen therapists actually like actively saying, and this is, obviously what they've been taught, that they help clients to discover the myriad ways in which they are oppressed, and I'm like,
Yep,
this is like
yep.
the
Or
opposite.
being oppressors.
Yeah, this is like the opposite of empowering. And as you said, they can't shake it because part of it is being so surrounded and reinforced and, so many gatekeeping methods with it that they have to subscribe or they won't advance. But also they're no longer being taught anything else. Like all
Right.
the time that, used to be going towards teaching actual, psychology information is now going, just towards teaching a bunch of nonsense. But
Have
what
you
I
met Ryan Rogers, by the way?
no.
I need to introduce you to Ryan Rogers. He's got a great podcast called Reality Therapy, and it is a hat tip to Glasser. But he's a student currently; he's about to graduate. But he what one of his like I guess one of the things that he's famous for is talking about how he did like a fold out cartoon or like what do you call it, a poster presentation of all the intersectional oppression people. It's like you always spent good class time on this, and I could have been learning systems theory. Right? Like that's the thing.
Exactly. Exactly. There's, could be learning so many things. In fact, speaking of that, there's a few just points of information I really want people to know when it comes to the mental health benefits of free speech. And these things are going to sound so basic, but I feel like people really just appreciate knowing them and like having somebody put it into scientific language. So, speaking of language,
Yeah, yeah, which is one of the things that's getting eroded, but please go on.
yeah, so language is one of our primary tools of actually cognitive development, right? So again, when we stamp out language and we make people feel like broad swaths of opinions are unsayable, I think what we're doing is we're tampering with their cognitive development. So it's through verbalizing that we develop good ideas and that we discard bad ideas, right? It's how we exchange
Mm-hmm.
information. Countless studies have shown that, through verbalizing is how we engage in problem solving. So that's the cognitive aspect. And I could go on about it all day, but there's also the emotional aspect. And again, studies have shown, and this is why it shocks me that our profession is so silent on this, but it's psychology 101 to know that naming your emotions helps you to be objective about them, to start thinking about them constructively. It reduces amygdala activity and it, facilitates emotional bonding. So then again, being authentic with each other is how we boost social support. Social support is key to mental health. And so if everybody's being inauthentic with each other because they're afraid of being canceled, we're totally degrading our social support. And so I just really want people to understand that there is a value, a true value in open dialogue, as well as, there's another chapter in the book about common objections to free speech, and one of them is, what about hate speech and bullying? And that's where I explain that it's actually through dialogue that we reduce our conflicts. I mean, if we're working with violent offenders, the first thing that we want to do is teach them to use their words and how to engage in dialogue, and it's through not talking that we actually, make ourselves more vulnerable to dialogue. And another one of the common objections to free speech in that chapter of the book is, well, what about misinformation? And, again, ironically, free speech is the answer. I list out various things that, all the supposed experts used to believe, like Galileo was jailed for saying, that the earth orbits the sun, or our own profession used to do lobotomies, or there's footage of physicians testifying to Congress that cigarettes are just fine for pregnant women if they use a filter, whatever.
Yep, yep.
So, the idea here is that free speech is a must, and whether it be in your personal life for people who are listening, I used to think that there was no real cost if I just kind of go along to get along. And again, I'm not talking about having no filter. There's also a chapter on the difference of healthy self-restraint versus self-censorship. But if you are censoring yourself to the point where people in your life who are supposed to really actually know you truly don't know what you really think or even think that you believe things that you don't think, there is a mental health cost. It's causing anxiety. It's a very anxiety provoking way to live your life. It's like putting yourself in the witness protection program, and you're not getting the benefit of real social support. And it's through heart to hearts that our cortisol levels drop, and I discovered all of this myself personally. It was, through my own kind of free speech journey that I went on when I started speaking the truth about COVID masks and I moved to Florida and I started realizing that speaking my mind was actually having a very positive effect on my cognitive, emotional, and, social life. And that's what prompted me to start researching this in the first place. And it led to the book.
I love all that because it overlaps so nicely with what I've been doing for many years, which is teaching emotional functioning. And you just encapsulated it perfectly. When you name and claim, as the phraseology exists in our world, your emotions, you drain the limbic system. When you drain the limbic system, you return cognition to the frontal lobe, and then you can problem solve adequately instead of trying to do it reflexively out of an emotional state. Um, Without that, we don't get dialogue because all you get is screaming matches based on emotion. There's another overlap here that exists with which is the suppression through threat, right? So in a domestic abuse situation or an employer abuse situation or even a church abuse situation, because there's churches that abuse also, you're not allowed to express ideas to the contrary of whatever the popular motif is or whatever the dominant theme may be, right? So, in a work environment or in a home environment or in a church environment or any organization that does this, self-censorship leads to what you had alluded to earlier, which is the almost the cluster B outbursts, right? The histrionic, the borderline temper tantruming, if you will. Because there is no authentic emotional expression in any other area, you can't process adequately what it is that's conflicting between parties. So we have to be able to express, and we can't just silence and ignore people. Otherwise, we put ourselves in a position of facing possible great backlash. So I've worked with lots of people, as I'm sure you have, who present as very borderliney, but it's because of a lifetime of chronic emotional invalidation that they don't believe they're being heard because they aren't being heard. So what do they have to do? They scream about it, right? So I can have a lot of compassion for that. The narcissistic presentation is very much the same. Now, that's, I'll put an asterisk on this and say that a lot of these people don't end up in our care voluntarily. It's because life almost compels them into it, right? But the ones who are authentically seeking insight and progress into their own development will tell stories of abuse, neglect, and violence that then shut them down. So if we're replicating that in the therapy office by saying that certain ideas or beliefs are unacceptable, then what we're doing is we're repelling people from care. And then when we repel people from care, they ostensibly get worse. And we can't have that. We can't be the profession that's leading the charge of self-censorship if we also are holding in the other hand, hey, come and get help from us, right? So we have to figure out a way to invite people in and advertise that it is a welcome environment and a positive setting to explore things. And through that interaction, you can find your own values, beliefs, behaviors, activities that help you get to where you want to go, based on your own decision making and your own parameters, not because somebody forced them upon you. Unfortunately, we're not there. So, through more dialogue like podcasts, I hope we can get there. Um, but I wanted to also add this. I myself experienced this type of self-censorship until I came out of the closet, like I've alluded many times before, as a firearms owning practitioner. And you've been on the Guns and Mental Health podcast. I appreciate your appearance there. It was quite good. But I myself have experienced that type of not wanting to express my authentic self, if you will, because I was surrounded by a bunch of people who were openly denigrating guns and the people, by extension, the people who own guns. And I'm sitting there going, you guys know that I'm right here, right? Like I'm sitting right next to you. I'm a concealed carrying therapist. And no, they didn't know because I didn't tell them. And I didn't tell them because I didn't want to face the ridicule and scorn based on their openly expressed hostility toward that particular part of my life. So we can't be doing that. You know, we want to be living ourselves authentically, but we also want to be open-minded to say, hey, maybe I don't have all the answers, you know, and I'm open to hearing more. What's your weight, by the way? I want to go through weight. You put that in the article. That's a nice
Oh my
acronym.
goodness. I thought you were asking for my body weight for a moment there. I was like, what?
Highly inappropriate, Mr. Whiskerson.
Where did that come from? No, but I will tell you about it's the WAIT technique, which is like when you decide that you're going to share something with somebody and you've been censoring for a long time.
I'm, the listening audience can't see that I'm still laughing and I'm probably red-faced right now, but
Yeah, me too.
I just muted myself so I wouldn't snort and guffaw into the microphone.
Uh,
Sorry about that.
no, that's totally fine, of course, but I mean, you said so many great things there too about, that there can be this invalidation that makes people feel, like they absolutely cannot, say something like, as you said, like, oh, gee, like I'm a firearm owning, therapist or something. And it's interesting. I go through this in the book as well. There's eight main ingredients to groupthink that set the stage for groupthink to happen. And one of them is an illusion of unanimity. So
Ah,
of course, I get into what that meant as well when the government created an illusion of unanimity by pressuring all of the major social media platforms to censor and take down, viewpoints that they didn't
yeah,
agree with.
yeah,
And so that
yep.
created a false sense of unanimity. And another one is actually direct pressure on dissenters. So, you did correctly recognize that if you were to speak up, you could be ostracized. And then next thing you know, you're being referred for some kind of a special examination to make sure that you're fit to continue in the program, or
Yep.
whatever the case may be. Um,
Any
and
such cases,
yeah,
unfortunately.
and as you said as well, like when people feel like they're so invalidated, then they feel as if sometimes they have to scream to be heard. What can also happen is that they're screaming about other stuff that has nothing to do with what they're even upset about, because what they're really upset about, they have gone through the suppression, repression, denial cycle to the point where they're no longer even fully conscious of, what's actually bothering them. And it's like I've seen that as well, as you said, within our own profession when therapists do that to clients. I worked once at a conference for families advocating for campus equality. They help young men that have been falsely accused of sexual misconduct, who have been like kicked out of schools and all this stuff without even so much as a police investigation. And I shared with the Division 42 listserv of the APA, like, hey, I happen to have been working with this agency and they have scores of young men that are looking for a therapist, because I sat with these young men in a little group breakout session. And they all said that it had been scarring to them that they went to a therapist to talk about the trauma of having been falsely accused and how to get back on their feet in life. And the therapist every single time would tell them, are you sure you didn't do it? Maybe you don't understand what sexual abuse is. I mean,
Wow.
and can you imagine a woman going to a therapist because she's been sexually abused and having the therapist's first reaction be, are you sure you were abused? Come on. Did you wear a short skirt? You know what I mean? And
Wow.
so
That is
it's like,
truly remarkable.
it is. And so I just wanted, you had said so many things there. I wanted to respond to them. But I will absolutely tell you about a technique, and I'll get to the weight one. But you said something else that, I made me think about another technique I wanted to share too, which is I love that you had said when you were talking about frustration of like, hey, I'm sitting right here when everybody's like saying all these negative things about people with firearms. And then you said, oh, no, they don't know because I haven't said anything. It is so awesome that you took ownership of that. And that's actually one of the techniques in the book, is that if you have been self-censoring a lot, and pointing out to people, you know what, it's kind of passive aggressive to assume that people will reject you and ostracize you and mistreat you for things that you have not even actually said, like you haven't even given them the chance, right? And so one of the things we do is in the book is talk about what's called, as I'm sure you know, narrating your experience. So to be able to say to somebody, you know what, I want to share with you that I have been holding back on you. And so this might come as a shock to you because you've been carrying on for months about your views about gun owners. And I've just been smiling and nodding as if I agree with you. And I'm sorry for that. I want to stop doing that. And so I want to share with you some views that I have that might be different, but I'm hoping we can talk it through and, still maintain our relationship. Like, would you be interested in that? And then the person has the option to say, no, I'm not interested. And then you've got your answer and you can move on. But at least you've given them the chance to have whatever reaction that you imagined they had. And that narrating your experience part, I think, is important because without it, people can get just so angry that one day they just have their own outburst and say, oh, yeah, well, I own a gun and I'm mad at you because you've been, disrespectful to people with guns for years now. And it's like, well, you never even gave the person a chance to have a talk about it, right? So it's so great that you had that thought process and took ownership of the fact that you had been self-censoring and you thought about how that could be affecting the relationship and, going from there. And that's actually a great lead into the weight technique,
Turns
like the
out I did
W.
get ostracized, by the way, but not all entirely for that.
But even if you do get ostracized for something, I mean, at least it can free you to find your tribe, so to
Yeah.
speak,
Well, it's been useful. I mean, certainly with the firearms community, because they're like, it's not the same anymore these days. But years ago, I would go to these gun shows or conferences, and the gun owners who'd never met a therapist before, they're reaching out their hands, like gingerly trying to touch my arm and see if I'm real. Like, you're not
Yeah.
a hologram. Like, you do exist. I do
Yeah.
exist.
No, I've had the same thing as a free speech therapist, a therapist that advocates for free speech. People are like, oh, it's like a unicorn, right?
Yeah.
But so with the WAIT technique, WAIT, it's an acronym, and so it's a technique to go through the process of thinking about breaking out of self-censorship. Because again, we don't want to have no filter, and we also don't want to feel compulsively obligated to tell everybody about every view that we have either. That's kind of like letting the pendulum swing so far in the other direction away from self-censorship. So the WAIT acronym is first we ask ourselves, do I want to tell these people, right? Even if I think that there might be a kerfuffle about it or whatever, but if I'm unhappy not telling them, is there a part of me therefore that kind of wants to tell them, right? So first you think about that, but if it's something you really just don't want to tell people, you don't have to. We have a right to privacy as well. And then the A is for appropriate. So we want to make sure we find the appropriate time and place. So, again, if you are, say, a student in a therapy program or something like that, maybe you want to speak to the professor privately before or after class to talk about some of your self-censorship thoughts that you're having rather than necessarily just, bringing it up for fair game in the middle of class without having given yourself any mental preparation about it. And another thing, by the way, as you think about that appropriate side can include making a plan, like maybe you want to have an ally available so that you don't feel like you're the only one. And then the I is for inoculate. So sometimes it can be helpful to give someone a little dose of what you think before necessarily going all the way into it. So with the guns thing, for example, a person, again, and there's nothing wrong with just saying, no, I just want to share it all, and that's fine. But the I is for the option to inoculate. So you might say, like, hey, well, you know what? I have some relatives with firearms, and they're actually pretty great people. And I wonder if we're making room for that in this conversation, that we don't necessarily have to disclose everything. We can start with a small amount and see how it goes. And then the T is for trust, that we want to ideally be able to open up when we really trust people. However, even if we don't necessarily trust the people, we can at least try to think about, can I trust in any way the system that I'm in? So maybe I'll take the policy manual of my university, pop it into ChatGPT and say, hey, ChatGPT, I feel like I'm being viewpoint discriminated. Can you tell me what are the university policies that would protect me, right? And so just learning about the information and the policies that can give you at least some kind of security, or maybe you decide you're going to, depending on your local laws, you're going to do like a Project Veritas film of the situation so that you're building some kind of level of trust or security for yourself if you're entering into what could be a dicey situation.
I love all that. It's very practical and applicable. I know that you're coming up on time here, and I appreciate you giving it to us. I guess one major question I have for you is if how do we help people understand that they're in too deep? Like I encounter this regularly where I have to deprogram students and interns who have come recently graduated, and they don't know that they have been indoctrinated with this this oppressive belief system, and that they've inadvertently become activists because they think that's the way it is because that's all they've ever heard. And because there's viewpoint suppression, they don't even know that there's another way until they run into Jake and his bombast in the middle of supervision. And I go, "Did you ever consider this?" And they're like, "What?" Um, how do you advise people do a self-check to make sure that they're actually being, I don't know, therapeutically neutral, I guess you could say?
Well, that's a really interesting question.
That's why I saved it for the end. Sorry.
Yeah, no, a self-check to see if, you're being, quote, neutral. I guess first of all, I think neutrality is a myth. I think we all have a value
Totally, totally. Yes,
system.
I agree.
And so, to that end, I think what might be helpful is to write down, what you see as your values as a therapist, and then invite another person or two or three or whatever to talk them through with you, because as you said, many therapists coming out of these programs today will openly acknowledge that they have a social justice mission to teach people about their oppression and all this other stuff. And so they would just, if you ask them to do a values exercise of writing down what are their, core beliefs and values as a therapist, and then, and you could do the same, and then invite people to challenge and to discuss them with you. I think that would be a great starting point. Um, I would just also say, though, that for therapists, and I've been there myself, that are in a situation where maybe you say, look, I am in this graduate program. I'm over six figures in debt. I cannot afford to just, make a stand and get kicked out of my program. And so therefore I am going to smile and nod and tap dance my way through this program. You might just make a strategic choice that that's what you're going to do. What I would urge a person in that situation to do is to make sure that you are writing down somewhere your real thoughts on a very regular basis and discussing the nonsense that you're hearing with other people, because it's kind of an abusive dynamic, right? If you're this vulnerable person, you're a student, everybody else in the school, they do have all the power over you. There is a financial burden situation. They are gatekeeping for your career. And if they are silencing you and belittling you and gaslighting you and insisting that you parrot back a bunch of nonsense, I think the word abuse is often overused, but I would say that one would qualify. And in an abusive dynamic, we know that it's very important for the victim to keep talking about what's happening so that he or she doesn't internalize it and normalize it and stop being conscious of the fact that it's wrong, because that's when the victim can get truly warped and when your self-esteem can get truly, just warped. So if you're in that situation, where maybe you are doing that values exercise and you're realizing that your values are totally different from your programs, and yet you feel like you can't make a stand about it, talk, 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 and don't stop talking or writing or finding some way to use language and its incredible powers, so that you don't slip into repression, suppression, and denial.
I like that. I have encountered both those situations, both with the student in the program who wants to take on the world, and I go, not yet. You need to graduate first, and then you get licensed, and then maybe if you still have fuel left in the tank, try to make change. And then the newly graduated person who sits in and shadows one of my sessions and goes, I didn't know you could talk like that to people, right? Because that's the other thing. We're trained to reflect, 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 pet, 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 stroke, 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 and there's no construction. There's no direction. There's no guardrails. There's no structure, right? So that's been a new conversation too. I appreciate that. I know we're out of time. This conversation could go on forever, but fortunately, there is a book, and the book is called "Can I Say That?" It's available at drchloe.com. That's drchloe.com. The slug afterward is slash free speech.
Actually,
Um,
I'm sorry to
yeah.
interrupt you, but I have an even easier way to get to that page
Oh,
because I know it's like
great.
a super difficult URL. People can just go to freespeechtoday.com and it will take
Beautiful.
them there. So freespeechtoday.com will get you there.
And if they want to hire you, go to drchloe.com. But
It'll all go to
hey,
my own website. Is that they
yes.
just go to freespeechtoday.com, it'll all go to the same place.
I love that, by the way, freespeechtoday.com. The other book is called Nervous Energy, How to Deal with Anxiety. And I would love that one so much that I bought it for my entire staff and handed it out to
Thank
them at
you.
Christmas time last year.
You're so
Um,
kind. Thank you.
yeah, yeah, no, it's I thought I told you that, maybe not. But yeah,
You did. I
everybody
think
got a
you
copy.
did, but I still
Yeah.
really appreciate it. Thank you.
Yeah, and they loved it. It's practical. It's very useful. So, and then because of Open Therapy Institute, I'll give a plug for OTI. OpenTherapyInstitute.com is another great place to go for more resources on th viewpoint diversity, true viewpoint diversity with no political agenda. So, thanks. Anything else? How can people reach you? The socials?
Freespeechtoday.com. Yeah, if they go
Yeah,
there, it'll have all my social media handles. And I do like to get active on Twitter and things like that. So if people want to,
you do.
share like with me or at me or anything at all, I'm going to Twitter a lot these days. So, but yeah, if
Good.
people do want to get the book, I would love to, if you send me a screenshot or something that you got the book, I want to be able to maybe start like a book club discussion group or something. So,
Oh, that'd be
um,
cool.
yeah, I mean,
Yeah,
of
it's
course, it would be free speech, right?
yeah, available November 4th. You could pre-order now. We're recording this mid-October. It should come out in about a week. So available November 4th. So pre-order. Um, and yeah, Twitter, where all good people meet, which is where we met, which is great.
Yeah.
So
Yeah.
thank you.
Thank you so much again, Jake. It's so good to see you, and I hope we get to do it again sometime.
Thanks, Chloe. Have a wonderful day. And on behalf of our Noggin Notes family and our Zephyr Wellness family, we wish you all great mental wellness. Bye-bye.